Hello, and welcome to the North Sound Weekly Webinar Series. My name is Leah Wainman and
Micah Osteen.
And this week's webinar is focused on data sovereignty. Some reminders. We want to check in around sort of housekeeping around these webinars as always. Just a reminder, all participant lines are muted. We encourage everyone to participate using the chat box. You can send your questions and at any time using the chat box in the Zoom window.
We will begin this webinar as usual with a land acknowledgement.
Good morning. I hope everybody can hear me. I'm Cindy Calti, and I appreciate ACH's commitment to begin by acknowledging the land. And although ACH is located on what we now call Lummi and Nooksack territory, we are all on the territory of the Laktamish people. We are sometimes referred to as Coast Salish people. We are the people who historically occupied this territory, extending in all directions without limitation, beyond the shorelines and the mountaintops. We sometimes like to say, as part of this territory, we are responsible for it, from white caps to white peaks. Haishka for joining us.
Thank you, Cindy. So now we will start the first part of this webinar with our guest speaker from the Healthcare Authority, Lena Nation. She is the Tribal Liaison for Medicaid Transformation. Following Lena's presentation, we will hear from Cindy Cutley, who will speak to us about data sovereignty from a tribal perspective, and she is a member of the Lummi tribe. After Cindy speaks, we will have our question and answer series. So any questions that are entered in the chat box, we will be able to respond to. And then we will wrap it up with talking about next week's webinar and the following webinars coming up in October.
Share my screen. And can you all see that now? Gonna assume you can. So good morning. My name is Lena Nation. Thank you for the introduction and thanks for having me today. This is a topic that I've been doing some research and reading on and talking to people about, but I do want to start with my disclaimer. And when I talk about this topic, I want to make sure that people know I'm non-native. I'm not a data or HIT, HIE expert. It's just that I happen to sit in this intersection at the Healthcare Authority between the Office of Tribal Affairs and Medicaid Transformation, so the ACHs and that idea of delivery system reform. I don't have any answers necessarily, so my hope with bringing awareness to this topic is really about spurring discussion and not necessarily about telling people how to do their business, but let's ask the questions and have a discussion so that we can do the best we can. So I just want to look at the question, what is data sovereignty? And then why do we talk about this, especially in Medicaid transformation and from my perspective of the Healthcare Authority? And maybe there will be some questions and people can talk about how they think this might apply to their organizations or agencies where they work, and thinking about next steps. So when I first started thinking about data sovereignty, I, in a very non-native way, went and Googled it. And there was the first definition that I found was that idea of the laws that govern the data are the laws of where the data is stored and located physically. So if we have a data, one of those server farms in India, then the laws of India would apply to managing that data. And that clearly is not the definition that we're talking about today. And so this was the definition I found from this Indigenous Data Sovereignty Toward an Agenda. It came out in 2016. It focuses a lot on different countries. New Zealand and New Zealand in particular is ahead and sort of leading the way in terms of data sovereignty. But to me, thinking about what do we use data for in our systems, especially our health systems and our healthcare systems, and how do we use that to make decisions around funding or around priorities, and how do we use that data to tell a story? And so thinking about that, right, the idea of a tribe as a sovereign nation, how does the United States use data? And why is data so important? And think about that on a tribal level. That's a sovereign nation that is running a government that includes healthcare, education, housing, social services, environmental services, and needing to take care of their people. And think about all the data that's required to do that, and who is collecting that data, and who is using that data and presenting that data, and who gets to analyze it and present it and say, this is the fact that comes from the data. So I really think that data sovereignty is a way of nation building, and that idea of self-determination for tribal nations has to include data. So to me, data sovereignty is really an important part of self-determination and nation building. And within the structure of Medicaid transformation, how are we talking about that? Going a little bit more into why data sovereignty, just thinking, and I'll try and kind of frame it for you guys up in the North Sound region, right? Who's collecting the data? So is it Whatcom County Public Health Department, or is the state collecting data? Is the school district collecting data? And then how are they collecting it? Are they swooping in, taking the data and then leaving? Are they being responsive? Do they give it back? Do they give it to state legislators who are making funding decisions about it? And then also thinking about the value of data. Again, in a very non-native fashion, I was Googling, thinking about this topic and Googling kind of the value of data. And, think about the purchasing of an Instagram or LinkedIn. Those were billions of dollars to acquire the data that we put in there. So even having data is considered highly valuable. And then you're thinking about how people are analyzing data, and you're thinking about how are they presenting that data? And are they presenting it from a deficit base where we talk about, disparities and we talk about sickness and illness, or are you talking about it from a strength-based perspective of resiliency and improving quality of life? So these were some of the things that came up for me as I was thinking about data sovereignty and thinking about how, as a state agency working at the Healthcare Authority, how are we using data, how are we collecting data, and how are we presenting data? Specifically, I had some examples where we were looking at HCA considering data sovereignty. We're doing a lot of information or a lot of work right now about health information exchanges and, you know, how do we do an exchange, or, you know, maybe you've heard about the clinical data repository and the work that HCA is doing around the clinical data repository. So, you know, who's putting data into the clinical data repository, who can access the data that's in there, who can take it out, what can they do with it, what right do they have to do with it. And thinking, I get a lot of questions, people talking about, you know, it'd be really great to have Medicaid data on what are the 10, you know, highest claims in the state, or what are the 10 highest paid claims in the North Sound region. And so how do we go about honoring and recognizing tribal nations and American Indian Alaska Native people, while also providing that data? And what's the onus on HCA to be honoring data sovereignty in providing that information out to different organizations and different agencies? I had a few examples where you as an ACH partner might want to consider data sovereignty. I haven't looked to see who's on this call, so I don't know if you're representing a clinical partner, a community-based organization, or public health, but are you looking at getting a new electronic health record? And how will you collect that data? And what are you going to do with it once you have it? And who are you going to share it with? Is the North Sound ACH looking at setting up a community information exchange that kind of takes the idea of a health care information exchange and moves it to the community to do social determinant data collection and data sharing and data exchange, and to track individuals? Are you setting up the pathways model in the North Sound region? And if so, how are you thinking about how you're going to engage with the Lummi Nation? And what if, you know, a Lummi citizen gets enrolled in the hub and then a bunch of information is collected, and then you present and say, oh, this individual wasn't able to get services, or this individual, you know, had all these challenges or barriers. So just thinking about the information that you're collecting in this space, what you're doing with it, how you're presenting it, and kind of what you want to achieve with that data. It seems like a topic that is very central to kind of the work we're doing of delivery system transformation, and Medicaid transfer, but keeping it to data sovereignty and the self-determination of tribal nations. And hopefully you knew that I was not going to have any answers. And also thinking about, if we have a data solution that works for not everyone, is that a solution? So I've kind of heard people, sometimes I get, you know, oh, it's such a small percentage of the population, you know, it's this tiny fragment, we'll carve them out. But if you create a health information exchange that is considered the baseline standard that all Medicaid data is going to be transferred over, and that's going to be the baseline, but it doesn't meet the requirements of tribal nations in regards to data sovereignty and in regards to a strength-based approach, is that really a solution if it doesn't work for everyone? Or do you do a targeted universalism where we're all going to the same place, but we have different ways of getting there? So maybe you do have a different platform for Indian healthcare providers to exchange information, but then, you know, that's a financial burden, and who pays for that, and who's on the hook for that, and We know the federal government has not been exactly forthcoming with funds for moving beyond the RPMS electronic health records. So you're kind of in this conundrum of, you know, if it works for some people but not everyone, or do we accept that there might be differences? So I these are the kinds of things I think about, and I don't have an answer. So I'm hoping that we can have some discussion here to talk about kind of the different approaches to this topic. And Cindy, I'm hoping that you might have some insight for us or can correct me. So that's kind of my slide deck in a nutshell and my kind of baseline presentation around data sovereignty. I hope I didn't go too fast, and I can't see any questions, so I hope that was what I was supposed to do. I'm going to pass it back over to North Sound.
Are we unmuted? Okay, thank you, Lena. And are there any questions for Lena? We will move to Cindy Colty from the Lummi Nation. And there will be opportunities for questions again at the end if anybody wants to speak, or feel free to type in questions as we go. Okay, Cindy?
Thank you, Leah. I appreciate everything that was presented so far, especially the thoughts about strength-based approaches and deficit-based approaches. I think we could do a whole webinar just around that. I am hoping to try to give more of a local perspective. Like what was said, that the tribes are sovereign nations, and our treaties are formal recognition of that. And in that, we are self-governing as tribes and have the supreme authority to serve our people and know what's right for our people. I wasn't really sure what was going to be presented, so sorry if I kind of fumble through this a little bit, but as a doctoral student and a researcher of my own tribe, I am really committed to the importance of data sovereignty and the right for tribes to control collection, ownership, access, application, and disclosure of their own data. This includes the right to drive their data agendas, governing their information, and self-determine the maintenance of and the privacy of that data. It's an area that tribes have struggled with, data has been used to work against tribes. So this movement to control their own data is very important. For example, I guess what I want to say is data sovereignty also includes the right to inform, the right to information that is extracted from their communities. So for example, data about Lummi really is Lummi's data and ultimately belongs to Lummi. Even if that data is stored within others' organizations. So in that, I'd like to encourage you all to be aware of if your organization is housing tribal data or data about tribes. And are you holding on to that information? Is that held tightly within your organization, or are you sharing it with the tribes? Did you collect that data on behalf of the tribe or for your own information? Did you partner with the tribes in collection of that? Which could be really important to how that data was collected and the access to the data. So when you partner with the tribe to collect data about them, when it's done with them, they have the opportunity to help with how that data is extracted, how it's collected. If you're to know if you're asking the right questions, or is there another way that they would suggest questions are asked with their people. And then how is that data analyzed? When you analyze it with your tribal partners, you're more likely to get answers or find understanding in a way that the tribe would understand that information from their background, the information they bring into the analysis. So I encourage you all to be aware of both what data you have and how that might help or even be more helpful to you if analyzed with the tribe, or if the tribe had access to that data. And data awareness is another one of those topics that really could be a whole webinar on itself. But to start thinking for yourselves, am I aware of what we have? Are the tribes aware of what we have? If I have questions about how this information could serve better, can I bring a tribal partner in to discuss that and look at it again? So what's the next slide? Oh, go ahead and go back. So I wanted to say a little bit about where Lummi is with data sovereignty. And I know many of our local tribes are kind of going in the same direction, but because I'm Lummi, I know a little bit more about where we are in that when data is being collected within the Lummi tribe, we have our own institutional research board. So our IRB monitors when research is happening within our community, or when people inside or outside the community are coming to collect data about us. And what our IRB is charged to do is that they try to assure that research conducted within the community is rooted in the community needs, engages with the community, and therefore ensures that it serves the community. And some IRBs also provide research and training like ours does, focused on methodologies and methods that are appropriate for the community. So if you have questions about how you're going about collecting your data and working with the tribes, then I encourage you to look to see if the community has a research board that could help come and provide some training, or at least have a conversation to better understand that area for the tribe that you're in, because we're all different. We all are going to have our own way of approaching and understanding what data is going to help, what our data agenda might be. So I think that's all I had to say, and I hope I've helped to raise some awareness and how data sovereignty can be applied with the tribes. And I'll turn it back over to Leah.
Thank you, Cindy. I think we had a couple of questions.
So we have these resources that we will chat out to everyone that are available. And then we also have time for questions now. So if you have any questions, please feel free to put those in the chat box. We have a few here already. So I'm going to unmute both Cindy and Lena. So the first question we have is, how can someone or an organization start a conversation with a local tribe around data?
That's a really good question. I think just being able to reach out to them, and like I said, if there's a research board, if there's even if there isn't a research board, I might reach out to the education committee and find out from them who, or the health commission committee, and ask them to point you in the right direction, who to have that conversation with. And I think anytime that you're approaching a neighbor tribe in the effort to do things right, that you're gonna receive the right response, and they'll point you in the right direction.
Do you have contact information if people were interested in contacting the Lummi IRB board?
The Lummi, I do. Well, I do and I don't. The Lummi IRB is housed at the Northwest Indian College. So if you contact the main number at the Northwest Indian College, they can transfer you there, or their website. So that would be the best way to contact the Lummi IRB.
Okay. This might be similar to the first question, but if organizations have data around American Indian, Alaska Natives, how do they make sure to get that back to those communities?
I would again contact the community, and depends on what the data represents, who you would contact. But most of our tribal nations have a main number, and those assistants are really helpful. I know, because I've had to reach out to them. And they're really helpful in trying to identify the correct person. But just making sure that the health clinic maybe, or the mental health clinic, or areas of community wellness, that they are aware that you are housing data that could be beneficial to them, I think that's a great first step. I know that when we try to gather data, it's really, because we're not good as tribes at collecting and housing our own data, it's really difficult to find all of the little pockets that have information so that we can make good choices. So awareness, I think, is key.
Thank you. And this is for either you or Lena. Do you have any examples of data sovereignty that's been done well, or instances when you've seen it done poorly?
I think that it's easy to find information about when data sovereignty has not been managed and how our tribes have been hurt by that. I mean, there's been instances where researchers have come in and collected blood samples from tribes and then housed that and reused that sample for something it was not intended for. So that's like probably on the extreme. But there's lots of examples like that where tribes have been hurt by data because it's housed, or information has been housed by outside entities and used as they see fit. And not always in this strength-based way. And I think that what we're doing right is really with our IRBs and trying to create our own research agendas, what research really is going to help us keep moving in that direction that we see that our people will help our people.
Thank you. Does anyone else have any questions? You can chat them in privately to admin and I'll read them out, or you can chat them in to everyone. We have both Cindy and Lena still on the line. If you have any questions that are really specific to Medicaid transformation that Lena can answer around data sovereignty.
All right, hearing none, I would like to thank you, Lena and Cindy, for your time and information sharing today. I learned a lot, and I hope everyone else did too. Okay, so before we close out today, we will take a look at our upcoming webinars. Our webinars are every Wednesday at 10 a.m. October the 16th, we will have a hub referral webinar. October the 23rd, and we will review the North Sounds ACH evaluation plan. And October 30th, the Community Information Exchange we will speak to. We will have a bonus webinar next Thursday, October the 3rd at 10 a.m., which is outside of our regular weekly time, but it is about the collaborative care model.
All right, and I just chatted out the evaluation link. It's very short, 4 questions, should take you less than 2 minutes. So if you could please help us make these webinars useful for you and give us some feedback, that would be great. Thank you, Cindy and Lena, so much for presenting today and helping us learn.
Otherwise, we will close this webinar out today. Thank you for joining us. Be sure to join us next week, same time, and links are sent out the Friday before. Otherwise, we will close out and upload this to the partner portal in case you would like to share with your colleagues or review again at a later date.
And next week's webinar is the reporting orientation, so please make sure that your reporting folks are on the call for that. It's very important. Thank you.